Hi, I'm Leonatine Beverly. I'm a registered nurse here at the Brooklyn Hospital Center. I am also the assistant patient care coordinator of the cardiac cath lab at Brooklyn Heart. My topic is going to be heart attacks. Let's talk gender inequality. So in order for you to fully understand what a heart attack is, I have to first explain to you what the heart is and the main coronary arteries. Again, the coronary arteries are related to heart attacks. So first I have to discuss that. And the easier way to discuss that for you guys to understand, because you're looking at a two-dimensional picture here, would be for you to look at it in a three-dimensional picture. So what you could do is form a fist like this so you can follow along with me. So a normal heart is the size of a fist, and it's a pump made of muscle tissue. The heart has three main coronary arteries that supply blood to the heart muscle, and that would be the left anterior descending, LAD, the left circumflex, and the right coronary artery. So if you look at your fist here, what you can do is you can follow me. The first set of your knuckles here is your LAD, and what you can see here is that's laterally would be your circumflex. And if you can follow me here on the top of the thumb and form a C in the back, that'll be considered your RCA, which is your right coronary artery. Now the RCA is pretty special too, because it also feeds its blood flow for the area of our electrical conductivity system of the heart, because we have natural pacemakers of the heart, and that would be the SA node, if you could see here. We have a previous slide that further that goes in more details with that. So what is a heart attack? A heart attack is also known as a myocardial infarction. It usually occurs when a clot blocks the blood flow to an area of the heart, as you can see here in this diagram, and this is the area of the damaged portion. This is considered to be an emergency, okay? You must call 911. You must get whatever closest relative to you to take you to the hospital. And remember, people like me have to get here after you get here to help you. So make sure you get to the hospital as soon as possible. So the causes of heart attacks are due to blockages, spasms of the arteries, and infection. So different blockages would include blood clots, fatty deposits, which is also here, this plaque. As you can see here is the clot, and a plaque rupture, which is basically a break off of the plaque. Spasms of the coronary arteries that is usually due to cocaine or amphetamines, heroin, that will cause the heart to go like, arteries to go like this, so therefore making it spasm and therefore causing a heart attack. And infections also, it's the body's response is to put it into an inflammatory state. Therefore, it causes, again, plaque to rupture whenever this happens to the body. So the different risk factors to heart attacks would be age. Men, the age of 45 or older, women of the age of 55 or older are more likely to have heart attacks than younger men and women. But there is a recent study that actually came out probably within the year that's stating that they're noticing that women between the ages of as young as 35 is having heart attacks. It's still more research that needs to be done to prove as into why that's happening. Tobacco use, smoking, this includes long-term exposure to secondhand smoke can also put you at increased risk. High blood pressure. Over time, high blood pressure can damage the actual coronary arteries that we discussed, and that occurs with different conditions such as obesity, high cholesterol, diabetes. It increases your risk even more. High blood cholesterol or triglyceride levels. High level of triglycerides is a type of blood fat that's related to your diet. It increases the risk of heart attacks. However, when you have a high HDL, which is a good cholesterol, it may lower your risk. Obesity is another one of them. The more obesity is being linked to high cholesterol and high blood pressure and diabetes, and just losing 10% of your body weight can actually lower your risk of having a heart attack. Diabetes is another one. For whatever reason, if your body is not secreting enough insulin, or if your body is not responding to that amount of insulin, it increases your risk of heart attack. Metabolic syndromes. Unfortunately, high blood pressure, obesity, again, high blood sugar, metabolic syndromes can actually cause these things, and making it twice as likely to develop heart disease. And if you don't have it, that's what the research is starting to show. A drastic reduction in estrogen levels, and I'll further discuss this in our slides in the future. What they're noticing is that whenever women have a drastic reduction in estrogen levels, it basically puts you kind of like in a lame duck situation, because all during the time when you're secreting it at normal estrogen levels, you're actually in a protective state. And there's more research. And again, I'll further discuss the details between male and female in the future slides. Family history of heart attacks and genetics. If your siblings or your parents or your grandparents have early heart attacks before the age of 55 for men, and females before the age of 65, you're definitely at an increased risk. Stress. We tend to overlook stress. We tend to not realize what stress actually does to our bodies. You might respond to stress in ways that can increase your risk of heart attacks. Illicit drug use. I've already discussed stimulant drugs like cocaine and amphetamines that can trigger spasms. Alcohol abuse. If you are binge drinking, it could cause you to have something called AFib, and it actually puts you at an increased risk of having heart attacks. Renal disease, kidney disease, hemodialysis. What's so interesting about this particular disease is that it increases the amount of calcium that's actually in your blood levels. Therefore, that plaque that we saw on a previous slide will be more calcified and more hardened. And a history of preeclampsia. If you have a condition that has had high blood pressure during pregnancy, it increases the lifetime risk of heart disease. Autoimmune conditions such as lupus or rheumatoid arthritis, those are just two that they're noticing, the research is showing that it increases your risk. And lack of sleep. I don't think we give sleep enough credit. If you have lack of sleep, your body is more likely to end up having a higher risk of having a heart attack. So major symptoms of a heart attack. The major symptoms, and before I discuss symptoms, I want to make sure that you guys fully understand, these symptoms have been documented for years. But it turns out they were specifically for men, because if you think about previous studies most of them were done on men. So there's definitely more research that needs to be out there to determine the differences between physiologically men and women. So let's start with the major symptoms of a heart attack. Extreme chest pain. If you're having discomfort, it's also known as angina. If you're feeling weak, like lightheaded or faint, if you're breaking out in a cold sweat, that is related to symptoms of a heart attack. Pain or discomfort in your jaw, your neck, or your back, one or both arms or your shoulders could be related to having a heart attack. Also shortness of breath, like I showed you the artery that goes down here. When there's a blockage there, it tends to cause a lot of shortness of breath. Nausea and vomiting, and a word called arrhythmias. I showed you with the RCA, the right coronary artery, that feeds the blood flow, particularly to that area, therefore causes you to have nausea and vomiting and have your electroconductivity be out of whack. Major symptoms in women. The most common heart attack symptom in women is the chest pain or discomfort. But however, women might also have non-chest pain symptoms, and they're less obvious, such as pain or pressure in the lower chest or upper abdomen. Could be thought to be indigestion, or it is indigestion. Nausea and vomiting, extreme fatigue. If you feel like you can't get through the day, or if you're at work and you're just like, this doesn't seem like me, I'm extremely fatigued, you might want to go see your primary care physician or your cardiologist. If you're having any jaw, neck, upper back pain, fainting, or just not feeling right, how many times have we had one of our female family members that said, I just don't feel right, and then when they go to their cardiologist, it's something related to their heart. So Gender inequality. Again, let's discuss like the research that's out there. The research that's already out there is noticing that public enemy number one is cardiovascular disease to women. It is the number one killer of women. It causes 1 in 3 deaths each year. So they're noticing that it's even more deadlier than all cancers combined. Now think about that. That's approximately 1 woman every minute that's dying of heart disease. And they're noticing also that at younger ages, less than 50, smoking is more harmful for women than men. Body weight increase during menopause is noticed. Unfortunately, once you're over the menopause and you're unable to get rid of the weight as easily. Blood pressure rises more steeply in aging women compared to men. That's due to the decline in estrogen. And also the diagnostic tools that we have, although they are reliable, they tend to be less reliable in women than men. And that could be for obvious reasons. You know, our breast tissue tends to get in the way of the imaging on certain stress tests, but they have to be done. They have to be sent for a cardiac catheterization to see 100%, because again, it's not the professional that can't read it. It's also what our bodies are generating. Women tend to be misdiagnosed and underdiagnosed. The unfortunate part of it is that women takes care of everyone. We worry about everyone. So therefore we tend to disregard our own symptoms. We go to the doctor and it's like, yeah, this is happening with us, but we're not fully upfront fully upfront with ourselves to realize what's really happening with us. So therefore women tend to be undertreated. And that's got to change. This story resonated with me. Miss Claudia Mercado, I got her story off of the Go Red for Women website that's for the American Heart Association. She had 2 heart attacks. The reason why she actually resonated with me, I feel like in the past 15 years I've been doing this, her story is just, everyone has this story, every female has this story. That in 2008, she was 45, she was having some chest pain and chest pressure, and she took, some Tums, or like she thought it was indigestion, and she went to bed, no relief. She called a friend, which we all do. Instead of going to the doctor, we call our friends, right? And she calls her friend said, you have to get to the doctor immediately, to the hospital. It turned out she did have a heart attack, and she needed 3 stents. Again, in 2013, on Christmas, she's having this chest pain again, and she said, this can't be happening to me again. And she didn't go to the hospital immediately, but her son, her family convinced her to go to the emergency room, and then she did have a heart attack. If you don't get anything from this particular slide or this particular presentation, the one thing that I would like for you to get is that listen to your body. Even if you spend 4 hours in the ED for indigestion, so what? It buys you time with your family. I cannot stress this anymore. So let's see how we can reduce the gender inequality. The cardiology guidelines should be more focused on sex-related differences when it is appropriate. Women themselves need to be more aware of their own risk factors and clinical signs of heart disease. We have to listen to our bodies. The one thing I tell my staff is that whenever we get a heart attack, we have to immediately move extremely fast. Think about time is heart muscle that you're depleting. And again, like I've already mentioned, remember that your team still has to get here to be able to help you. Also, many biological differences and blockage buildup between men and women that are not yet clarified, and they're going to need further research. So let's see how we can combat someone having a heart attack, because I also need you guys to also remember that there's still so much out there that we don't know as professionals in the healthcare community, that it's extremely, we're going to need to do definitely more research, and definitely has to be more literature out there, because they still don't know why people have heart attacks after they do all these lifestyle changes. But again, if most of us do this, we can decrease the amount of heart attacks that we have per year. So if you monitor your blood pressure and cholesterol levels, make sure you get your numbers. If you don't have a blood pressure monitor at home, make sure that you obtain one. I believe that most insurance companies do cover them. I think they run maybe about like 25, 30 bucks as well. Take medications as prescribed. You know, make sure you're managing your diabetes and other health conditions to avoid the fluctuation of numbers in your body. Pay attention to your body. That's one thing I want you guys to understand. Pay attention to your body. Quit smoking, regular checkups with your cardiologist. Make sure that you have a good rapport with them, because again, the more and more we downplay if your doctor knows you, he or she will be like, this doesn't seem like you. Let me get more tests. Let me run more tests. Also, exercise regularly, at least 30 minutes per day. The American Heart Association recommends that. Reduce stress. Let's practice self-care, ladies. We have to make sure that we take a deep breather and not get so stressed out. And choose good nutrition. Limit salt intake. Reduce high fatty foods. I am from the low country of Charleston, South Carolina. We love our seafood, shellfish, and fried. It has to be fried, even down to our blue crabs. But again, our body's not made to be able to break down those fats. Limit alcohol consumption. Maintain good sleeping habits. Again, sleep is always overlooked. And you want to aim for a healthy body weight. We are here to help you. You can, if you have any questions or any concerns, if you don't feel right at all, make sure that you call us up. We're here to help you, 718-250-8627. There's a list of cardiologists here that is willing to answer any questions. We're located at the Physicians Pavilion at the 9th floor, right here on St. Felix Street. And please don't hesitate to leave your messages, questions, and comments. Thank you for watching.